The newsday continues here on One News Now. I'm Riza Diaz. Lawmakers and President Duterte's economic team have compromised on lowering the target volume of the country's pork importations, but the issue on lowering tariff rates is still not settled. According to Senate President Tito Soto, the economic team and senators have agreed on a 254,000 metric tons minimum access volume on pork, but they reach an impasse on tariff rates, as senators are pushing to lower the 40% tariff rates to 20% and the 30% to 15%. While the economic managers disagree, citing the effect this may have on inflation. Soto adds that he doesn't want this disagreement to come to a confrontation and hopes that the senators and economic managers could reach an agreement before Congress session resumes on May 17. Not even the raging COVID-19 pandemic can stop the 2022 national elections. That's according to COMELEC spokesperson James Jimenez. In a tweet, Jimenez said that the elections will not be canceled just because of fear due to the pandemic. Jimenez explained that COMELEC can only suspend the polls or declare failure of elections when it becomes impossible to hold free and fair elections. This comes after one user asked if the poll body can justify the cancellation in light of the COVID-19 developments in India. The COMELEC spokesperson also pointed out that there is only a year and 8 days left before the 2022 national and local elections. Now, here are some of the biggest stories we're following across the world. Thousands of people attended the Strawberry Music Festival in Wuhan, China yesterday. Revelers in the central Chinese city danced, bounced, and screamed with delight as some of their favorite acts took the stage. Now, according to Reuters, the festival was making a return in Wuhan after it was reduced to an online event last year due to COVID-19 restrictions. A representative for the organizers said that only around 11,000 people were allowed to attend, as number of attendees are still being restricted this year. Some spectators wore masks, but most did not. Residents in Wuhan, where COVID-19 first emerged, has lived through months of stringent lockdown and has been almost virus-free since. North Korea called U.S. diplomacy spurious after it dismissed the idea of talks with Washington. This comes as a Biden administration said it was open to diplomatic negotiations on the denuclearization. The North Korean Foreign Ministry said that diplomacy was a spurious signboard for U.S. to cover up its hostile acts. It also warned U.S. President Joe Biden that he made a big blunder with his outdated stance towards North Korea. In his first address as president to Congress, Biden said that he would use diplomacy as well as stern deference to contain North Korea's nuclear ambitions. India hits another grim milestone as it records over 400,000 new COVID-19 cases in a day, the first country to do since the pandemic started. India's health ministry reports that nearly 402,000 new infections were tallied, bringing the total caseload to 19.1 million. There were also over 3,500 deaths recorded, pushing the death toll to more than 211,000. Now, many experts suggest that the real numbers are much higher due to insufficient testing and inaccurate recording of cause of death. Now, as India struggles to fend off the devastating effects brought about the pandemic, a health expert from Johns Hopkins tells the world to learn from India's COVID-19 crisis, saying it is not just a one-country problem. Let's listen into this Bloomberg Quick Take.
Joins us now for more. So, Nisa, thanks so much for being with us today. I mean, every day things in India seem to be getting worse. The pictures are just horrifying to look at. How much of the global fight against COVID should be directed towards India? I mean, should the U.S. be putting even more resources towards the country at this point?
Well, you know, Jennifer, first of all, thank you for reporting on this story, because it's such an important story, because if we don't learn from India, we may be in the same place ourselves. So yes, I think that it's important for people to get together. I've talked about this since the beginning of the pandemic. This is not just one country's response. In order for us to battle this, we need to do this in a unified manner. I really like what Amazon and Gilead and some of these different companies are doing. India is the world's largest democracy, right? So there is some infrastructure there. So what's concerning is to see how all of this health system is crumbling in the face of this pandemic. And what can we do to not have history repeat itself here in the United States?
Can you talk about that a little bit, Nisa? Because I'm confused about, here we are with vaccinations having done so well. Is the concern that this could again happen? And I say again because we were in such a bad place a little over a year ago here in the U.S. and back in December, January, too. Thousands of people dying a day. How could this happen here in the U.S.?
So, Tim, that's a really good question. But again, you look to India. They were pretty strong on their vaccines, right? They developed their own vaccine. They had a really strong campaign going. And then they got hit with some big super spreader events and some other pieces, right? So what can we, it's not that we're going to end up there, but what can we learn from this? So we have to continue really strong with our vaccine rollout. We have plenty of vaccines now. Our next step is to get them into as many arms as we possibly can. Because when you talk about New York reopening, right? Anytime you're going to put people together in a space, whether it's Broadway or whether it's a restaurant, and you have vaccinated and unvaccinated, and you have variants, you're creating a situation where you could cause this pandemic numbers to increase in New York.
The U.S. Centers for Disease Control and Prevention has issued guidelines for people who have been vaccinated against COVID-19. Johns Hopkins professor and virologist Andrew Pikosh discusses this on Bloomberg.
Vaccination will not only protect from severe disease, it'll protect from symptomatic disease, and will even reduce transmission. So getting vaccinated is going to now have a major impact on the pandemic. We assumed it would, and now we have the data to support that. So these relaxations of the guidance of the public health restrictions for vaccinated individuals reflect the fact that if you get vaccinated, you pose less of a threat to the rest of the population in terms of passing this disease on to people. So I think that's a good thing that you're seeing.
Andy, I think some people are still struggling with the logic of certain requirements of them, though. So let me give you an example of it. You go into a restaurant right now in New York City, you can sit down with your friends, take your mask off and have a meal. But if you dare stand up and walk to the restroom, you better put that mask back on. Now, Andy, I say that in a flippant fashion. You'll forgive me, I'm sure. But that's how people feel right now. They've been vaccinated. They go into a restaurant, they sit down, they take off their mask, they eat, and then they walk to the restroom and have to put the mask back on. What is that about?
Well, partially it's to also think about the other groups that you're not interacting with. As a vaccinated individual at this point in time, you really should be paying attention to the groups that you're interacting with. We're not giving people a free rein to just go out and socialize with anyone and everyone. We still have to be careful in terms of who you're interacting with, because we want the rest of the population to also reach this level of immunity so that we can have further blockades in terms of the ability of the virus to transmit. We don't want to rely on one individual and their immunity to protect the entire community. We need other people to get involved in this. And so while vaccination reduces the risks of transmission tremendously, it doesn't eliminate it. So until we get to a level where most of the people are vaccinated, it's still good to have some of these reminders that we're not out of the woods yet. We still have to be careful and measured in terms of how we're approaching this pandemic.
Andy, are public health officials at odds in some ways with the elected officials that are trying to get their economies going quicker? I mean, the idea here that you have the likes of Mayor Bill de Blasio saying everything's going to be reopened, while you've got the CDC that still won't give guidance saying that you can go and be part of a bigger group if you've been vaccinated.
Absolutely. These are going to be conflicting goals in some perspective. I think there's no public health individual that wants to see the economy continue to be shut down. All public health individuals, have families, have lives. They want to get back to some semblance of normalcy. It's just simply a question of the rate at which we do this. It's a reminder when you look at the case numbers that they're falling, but they're still at a very high level. And with vaccination rates slowing down across the U.S. in particular, we are a little bit worried that we're going to hit some sort of plateau of vaccinated individuals that's much lower than what we need to really make a major impact on the spread of this virus. And I think that's the real area where we're conflicted in. How do we keep pushing to get the immunity up in the population? Because that will eventually allow us to open up in a much more safer way.
Andy, how effective are vaccine passports? Some people have complained that perhaps they're not that effective because we don't know how long the vaccine will remain effective for. So if it's 6 months, they won't be applicable after that. Other people saying it's just a political issue that they're not being implemented currently.
Well, I'll leave the politics aside, but if you speak from the science, a vaccine passport that has an accurate date in which you've gotten your initial vaccination and your booster will actually is a relatively good way to keep track of your immunity. We'll know over time how long that immunity goes. So if you have documentation of when you got vaccinated, you can be put on that scale of how relatively protected you are. So scientifically, there are ways that you can capture this information to be accurate. Obviously, politically, it's a whole other issue in terms of whether or not people want to go to that extreme and for what things they want to have a vaccine passport to allow them to take part in those.
And that's how the day is shaping up to be. Join us again later at 1 in the afternoon as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands and stay safe, Philippines. We are One News.